Now to a major investigation into the rising number of women suffering injuries in childbirth. Sky News has analysed data from NHS England, finding a 25% rise in women who experienced a third or fourth degree tear in the past 5 years. Our health correspondent Laura Bundock has spoken to one mother who suffered a third degree tear about the lasting impact the injury has had on her life. The report does include descriptions of injuries suffered during childbirth.
Sometimes when I remember the feeling, I will a physical shudder comes over my body. I think anyone does when I tell them the story.
We first met Megan, 36 weeks pregnant and preparing for her second child. 3 years ago, she gave birth to her son, Roman. It was a low-risk pregnancy. That changed when she went into labour.
I can still remember the feeling of his head reaching, crowning, and I just got this huge, my body did it for me, urge to just push. And I did, and I can remember the feeling of the tear from from the start of the vagina all the way down to my perineum. And I remember the feeling of it actually ripping open and screaming. But the midwives didn't say anything. They didn't say stop, or they weren't coaching me. They just were there ready to catch him.
Megan had suffered a third-degree tear. They usually require surgical repair and follow-up care to restore continence. It's still relatively rare in childbirth, but is becoming more common. Around 1 in 35 women, or 2.9% who gave birth in England in the last year, had a third or fourth degree tear, compared with 1 in 43, or 2.3% in 2021. That's an increase of 25%. Higher rates of tearing are associated with birth instruments like forceps. In 2024, 1 in every 15 births in England, around 6.7%, was assisted with forceps, compared with 1.2%, or 1 in every 85 in Norway. And rates of third and fourth degree tears are 70% higher in England. The childbirth injury charity Masic estimates one of the most severe types of tears costs £50,654, which includes things like healthcare, counselling and loss of earnings for mothers and their partners. When taking legal claims into account, this figure rises to £464,000 per injured woman.
I wasn't told about how to recover from such a surgery and a tear. So I did a lot of my own research in the end. When I got back from the hospital and realised what I needed to do, I self-referred to the physio to try and get my pelvic floor back intact, which eventually I did, but it took months, up to 9 months, to feel physically back to normal. I feel like I missed out on the newborn stage with my son because I was so sad and so traumatised and in so much pain with what had happened.
A recent NHS report found tears were wrongly categorised in 58% of cases, with women who'd suffered severe third or fourth degree tears being initially diagnosed with lower grade tears. The Chief Midwifery Officer for NHS England, Kate Brintworth, has told Sky News the NHS is taking action to transform care for pregnant women and their babies, including introducing new clinical standards to reduce avoidable harm, targeted support for services that need to improve, and work to tackle unacceptable inequalities in care and outcomes.
It can be really lonely and really traumatising, and just to have that humanity and somebody just ask if you're okay and, and what they can do for you next and explain what's happening to you at the time. This is actually somebody's life. This is going to change somebody's life forever. They're going to remember this day forever. So it would be really nice just to be treated like a human.
Laura Bundock, Sky News.
If you've been affected by the story, do contact the Samaritans. You can do so at any time. The number 116 123 116 123, or visit the website samaritans.org. Tonight, we'll have a special edition of the UK Tonight on the state of maternity care. Sarah Jane has been at University Hospital Coventry this week and will present the show live from there, speaking to families, expectant mothers, midwives and other NHS staff. If you'd like to share your maternity experience with us, please do send an email, maternitystories@sky.uk.